Welcome everyone, this is Dr. Beata, and on today's live Q&A, we're going to be talking about 5 unexpected signs and symptoms of leaky gut, and this is specifically for moms and their little ones. And so the first question I just want to ask in general is, have you ever heard of leaky gut? And we're going to go into a little bit of what it is. And then if you have any signs or symptoms as I go through these things, I'm curious if you identify with any of them. So let's go ahead and get started. For those who don't know me, my name is Dr. Beata Hadashim, and I'm a holistic and integrative doctor of physical therapy. And I specialize in helping moms and their little ones heal holistically from leaky gut using an integrative approach. And especially if the little ones have colic, eczema, reflux, food allergies, etc. So number one that we're going to go into is, as a mom, if your child does have these things, colic, reflux, eczema, or food allergies, there's a really good chance that you may have leaky gut. Now, let's backtrack a little bit. So leaky gut, what it is there is a barrier in our gut wall, in our lining, in our intestines. And that barrier is there to prevent, so when we eat, right, and food and certain things that go into our digestive tract, certain nutrients do get pulled in through that barrier and get into our bloodstream. So nutrients, vitamins, things that we want there. What we don't want is undigested particles of food or other pathogens, etc., getting into our bloodstream, because that can create a systemic effect, an autoimmune effect, etc. So the fact that your child may be presenting with some of these signs or symptoms suggests that they may have leaky gut. And ultimately, this leaky gut comes from a combination of things. It comes from our microbiome, so our gut microbiome as moms. And what that means is a combination of bacteria, viruses, different fungi, different yeasts, different microorganisms that create this environment in our gut. So when we have an imbalance in our gut microbiome, our child tends to get that from us. So they tend to get that through the birth canal, even just with contact. We pick up different microbes through contact, skin to skin. And also if you're breastfeeding, your child is getting some of your gut microbiome as well. And now I don't want you to panic if you are hearing this and you're like, oh no, I'm going to go through some steps that you can take to help heal this as well. So that's number one. And it's an unexpected sign because many moms aren't aware of this. So it's the one I want to start with and bring a little more awareness to. So number 2 is fatigue. So who as a mom has ever felt tired? I think many of us have, right? But fatigue is a whole nother level. Fatigue goes to the place where we are so just exhausted. We maybe even have a hard time falling asleep because we're so tired. Or, we are just dead tired, can't get ourselves out of bed. This also goes for, just feeling like you don't have energy or like aliveness or excitement during the day. And this can sometimes be in combination with depression. You may be gaining weight. You may have like an impaired metabolism as well. And so these are some of the symptoms to look out for. What may be underlying this? There's many different things that can be underlying this. So sleep deprivation may be one of them if you haven't been sleeping well. And if this is something that you are experiencing challenges with, I do offer a first step to the best sleep workshop for free. So if you'd like that, you can go ahead and just type sleep in the comments, and I will get that for you. If you are going to be watching the replay on YouTube, I will link it below as well. And if you are watching on YouTube and you like this kind of information, go ahead, like and subscribe. So there's multiple reasons why fatigue may be happening, but one specifically for moms that I want to focus on is also thyroid health. So one of our moms in our private community actually mentioned this earlier today, and the thyroid has a huge piece in fatigue. And there's various thyroid conditions that if you'd be interested in doing a one-on-one consultation, I can help guide you as far as what labs may be helpful to get an idea of your thyroid health. So fatigue is a big one. And again, there's kind of layers to this. There's various underlying reasons that things may be happening. But again, leaky gut directly affects the thyroid. So that is a connection that, again, many are not known, many don't know about, and it's a little unexpected to hear sometimes. So number 3 is mood changes, right? So postpartum, some of us, including myself, may experience postpartum depression or anxiety. I was more on the anxiety side. And so sometimes these mood changes, again, the energy levels, how anxious you feel, how depressed you may feel, may be one of the underlying reasons, maybe leaky gut as well. There is something called the gut-brain connection. Have you heard of that before? Essentially, there's something called the vagus nerve, and it connects from, it's a cranial nerve, so it connects our brain down to our organs and especially the gut. And there's an intricate connection that happens there. And the key is that we can also use that to heal. That's the cool thing. So what this does is our digestion and our health of our gut can actually affect our mood, can affect how well we think, can affect if we have a foggy brain or if we have trouble focusing, etc. How responsive we are, how reactive we are, and also things as a mom that are important, like our patience, our joy, how alive we feel, how energized we feel on a daily basis. So that's, again, a not so well-known, unexpected sign of leaky gut. Number 4 is skin conditions. So certain things like acne or eczema or psoriasis, again, in you or your little one. So with this, again, not only is there a gut-brain connection, there's a gut-skin connection. So especially if the gut microbiome is not optimal and there's some leaky gut happening, there are some particles getting into the bloodstream that can actually essentially show up in our skin. So that is, again, kind of an unexpected sign of leaky gut. And then number 5 is autoimmune conditions. And this is something that I had personal experience with. So just a little bit of a story. When my daughter first had all these conditions, she had colic, reflux, eczema, she had severe food allergies through my breast milk. So when we were on this journey, I think it was about 1.5 years in, I found a practitioner who also practiced holistically and used an integrative approach, and we got some labs done. And what I recognized and what she saw was that my autoimmune markers were elevated, and my lupus numbers were quite high. So what was going on is that I ended up having leaky gut. And because of this, my autoimmune markers were going up. What this means, if you're not familiar with autoimmunity, is that essentially your own body starts recognizing itself as a threat and it starts attacking itself. Autoimmune disorders are chronic. They are, widespread. There's a lot of them out there, and there's more and more people getting diagnosed. Now, the good news is that using the protocol that I now teach and coach through, I was able to get my lupus markers down to normal and my autoimmune markers down to normal. So even though conventional medicine says that autoimmune disorders, once you get them, they are chronic and a lifetime disease, I want you to know that you can reverse them and that there are ways that you can decrease your numbers, have yourself feeling better, right? So it's not just about labs, it's about how you feel. And I know myself, from my experience, I was able to heal that autoimmunity that was brewing and just about getting over that edge. So if you yourself as a mom are seeing some of these signs or symptoms, or maybe you have had labs done, I want to give you hope that there are ways that you can help reverse that autoimmunity and get yourself feeling better again. So again, the autoimmunity stems from the leaky gut, that intestinal permeability where things are now getting into the bloodstream can have a systemic effect. So the 6th one, I'm going to add in a bonus, number 6. This isn't unexpected because this, if you're familiar with leaky gut, is what most people know about. And that is that you're going to have digestive issues. And the thing I want to mention is that not everyone has digestive issues that does have leaky gut. So that is the kind of caveat here. And that is where it's helpful to work with a provider, because when we all are so unique, all of our bodies are individual. And when we have underlying symptoms, when we have these root causes, in some people and some babies, they may present as eczema. And in others, they may present as reflux. And in others still, they may present as diarrhea or constipation. Now, the interesting thing is that the underlying reasons, the root causes may be the same for all of those individuals, but they present themselves differently. Now, the reason why is because our bodies are so individual and unique. We have different genetics, right? So there's something called the study of epigenetics. So we start with a genetic DNA essentially, but the expression of that DNA and activation of that DNA, we can actually modify and change using diet, gut health, nervous system regulation, which is something I'll talk about in a minute. So this is the thing that it can be challenging when you're trying to figure things out without having someone to assess and evaluate. You may be thinking, oh no, I don't have leaky gut because I don't have digestive issues. You still may, they may just be presenting differently in you. So some digestive issues that I do want to go over, just because this is kind of the broader frame, is that you may have undigested food in your stool. You may have difficulty digesting. So you yourself may have reflux. You yourself may have a lot of gas, or you may find yourself burping often. Vomiting may be a sign of it. You may be bloated. Bloating is a huge one, that there's something not happening great with your digestion. So bloating, gas I mentioned, diarrhea, constipation. Constipation is something I have a whole video on. So if you'd like that video, go ahead and just type constipation in the comments and I will get that to you. Again, in YouTube, it'll be linked below. But as far as constipation, so just a general overview, ideally you want to be going at least once a day. Same thing for your little ones, even if they are breastfed. And there is a range of normal. As always, there's always a range. So I like to give up to 3 days. If you are not having a full, like a really good bowel movement every 2 to 3 days, then that's a sign that your digestion's off. But again, I go more in depth in that constipation video, so I can get that to you if you need it. And what was the other thing I wanted to mention? Oh, so other conditions, right? We go into those autoimmune conditions like ulcerative colitis, Crohn's disease, inflammatory bowel disease. Leaky gut is associated with those as well. Other signs and symptoms. So again, we talked about diarrhea. If you're seeing blood in your stool, that's a sign that something may be going on. Again, if you're very gassy, if you're bloated, if you have stomach pain and cramping, that may be a sign as well. So now what do we do about it? Oh, I'm sorry, I missed one thing. Food allergies and sensitivities. So along with that digestive piece, right? If you are experiencing a lot of food allergies or you're getting more and more sensitive to foods, that is also a really big hallmark sign that you have leaky gut, that things are getting into your bloodstream, you're getting sensitized, and it's a systemic process. So what do we do about it now, right? What can we do about it? There are a couple key pieces that I like to look at with leaky gut. One is nutrition. We need to make sure that you are getting nourishing foods in. That is ultimately our number one goal, because if we cannot regenerate, repair, restore our body, we cannot heal those junctions and close them up so that the intestines are not permeable anymore if we're not getting the nourishing foods in, so we have the building blocks to do so. Number two is gut health and the microbiome. Now, for this, there are many pieces to it. So there's many moms that I connect with and they're like, oh, we're doing probiotics. Great. Probiotics are just one tiny piece of gut health. So, and honestly, myself and my daughter, we actually didn't even use probiotics for the first over a year of our gut healing journey, because there were so many other factors that we were working on and we actually couldn't tolerate them at the time. Now we can, and we have lots of probiotics, but they're not appropriate for everyone at the right time. That's kind of the key piece. Now, the next thing is nervous system regulation. Nervous system regulation is something we don't think about often and that hardly anyone is talking about in this area specifically. And I want to be well known and talk about it a lot. Essentially, there's something called fight or flight. Have you ever heard of that? So there's a part of our nervous system when we, historically, thousands of years ago, if we were walking in the forest and something rustled in the woods, our nervous system switched over to fight or flight. What it means is that we're thinking there's a threat there. Maybe there's a bear in that bush. We need to know, are we running away from that bear? Are we trying to fight it? What do we need to do to survive? There's also something called fawn and freeze, but we're not going to go into that in this video. But those are also states of that nervous system response that happen. And it's a reaction, right? We don't think about it. It just automatically happens because it's a survival instinct. Now, that survival instinct has served us very well for thousands of years. It has, helped with the survival of our species. However, when that is on, our literally physiology goes into running away or fighting, and our digestion isn't optimal. So there's the opposite side, which is the parasympathetic nervous system. That is our rest, restore, regenerate state. We want to be in that state. However, nowadays with modern life, we get a text message that may be upsetting. We get an email from our boss. Maybe our child is screaming and whining, etc. Our fight or flight system gets activated nonstop. So what that means is that we are not in a rest and restore state. We are not in a rest and digest state. When that happens, I don't care what you're eating. I don't care what probiotics you're taking. I don't care what healing protocol you're on. If your body is not in the parasympathetic nervous system state, you're not going to get optimal healing. So that is something that is so crucial and something that I focus on a lot. And we're going to go through a quick exercise for that in a moment. And then there's also something called emotional energetics. So what this is a form, an alternative practice that I have actually used and combined with these more conventional models, because essentially if we have it doesn't even have to be like a huge trauma, but for example, I'm going to give an example from my personal experience, is that as a child, if you were constantly being told that you can't do anything right, or you're doing this wrong, you're doing that wrong, etc., that leaves an imprint emotionally in you, right? When you're approached with certain situations, you may think like you're not going to do a good job or you're not good enough, etc. That emotion has an energy to it. And sometimes these things are called trapped emotions, and they can literally live in our body. And we react to certain things, and we automatically go into that pattern from childhood most of the time, because it's ingrained in us. And unless we take the time to work through that energetically and emotionally, that pattern is going to persist, and that affects our healing as well. And a huge, huge piece in gut health. So again, this is a piece that no one else is talking about and is crucial. It was absolutely crucial in our own healing journey. It wasn't until I took the time to look and to do some of that deep healing work that we started to see the progress really start rolling and moving forwards. And also spiritually. So for myself, when I think of, I believe that we all have a soul. We all have a soul, which is underlying us as humans. And the best way that we can tap into our soul is through our heart. Because oftentimes, I'm not sure if you've experienced this, where you just have like a gut response to something. You feel like your heart just knows. If we're not aligned with our soul and we're not listening to our heart, that creates a resistance. That creates a resistance in our body. And so this may look like something if you've ever been in a job that you hated, right? Where you're saying like, this job is like sucking my soul or killing my soul, okay? And I know sometimes we have to do what we have to do, but when we're not in alignment that way, that has a physical effect on our body, on our gut health, on our other physical organs, etc. So these are all the components that I work through when I work with moms and families, coaching them. And there's various levels to this. So right now it's the month of September. I have one spot available for one-on-one coaching. And there's also a group or community coaching program that I'm going to be starting in a few weeks on October 10th. And this is going to focus on that nervous system regulation and the emotional energetics. Now, the reason why is because, like I just said, I don't care what you're doing nutritionally and gut health wise. If you aren't in a nervous system state where you are more in parasympathetic than the sympathetic state, when you're not in a rest and digest state, no matter what you're doing for gut health and healing, you're not going to get optimal results. And especially as moms, from my personal experience, I know how stressed and overwhelming it can be. And until we learn how to regulate our nervous system during those stressful and overwhelming moments, we're not going to get the healing that we want to see. And therefore, our children are not going to get the healing that we want them to see as well. So this is all, in my opinion, crucial. We need to take this multimodal, this integrative approach and combine all of these to get optimal healing. So for the moms who do want the one-on-one guidance, especially with the nutrition and the gut health, again, I have one package available right now for the month of September. And for those who maybe feel like they have a handle on the nutrition or just aren't quite ready to dive really deep into that, the nervous system regulation and the emotional energetics piece is a wonderful way to get started, and it's going to transform your daily life. You're going to feel more energized. You're going to feel more present with your kids. You're going to be able to handle their crying, their screaming, their tantrums better. You are going to sleep better. You're going to feel energized and alive and excited. And you're going to get some of that passion for life back, which I know I lost, and I know many moms have lost as well. So let's go through an exercise now. And this is one of my just very basic foundational exercises. And I invite you to join us and do it. It only takes a minute. And this is something I call a mindful breath. And this is a wonderful way that we can start getting our body into that parasympathetic nervous state in just seconds to a minute. And you can do this whenever, wherever. So if you feel comfortable, I invite you to close your eyes. You can put your hand over your heart. And what we're going to do is I'm going to guide you through. And the first thing I just want you to do is check in with your body and see how it feels as far as how fast is your heart beating? Do you feel any pressure or pain anywhere? How is your breathing? Is it shallow? Is it deep? Maybe you're holding a baby, so you have someone to cuddle. And so what we're going to do now is just take a deep breath in through the nose into the belly, really expanding your belly. And now a really long exhale through an open mouth. And again, in through the nose, into the belly. And a nice long exhale through the mouth. And again, in through the nose, into the belly. And a nice long exhale through the mouth. And now I just want you to check in with your body again. And how does your heart rate feel now? Mine has slowed down drastically. I'm excited when I present. So now I can feel that heart rate coming down. I feel calmer. Same thing, check in if you have any pressure or pain, any sensations in your body. And this is a wonderful way to just become present in the moment. And you can go ahead and open your eyes. And kind of the ratio, if you do this breathing exercise, is about a breath or a count of 4 on the inhale and about double, so a count of 8 on the exhale. If you're not able to get to 8, that's okay, but you want to start working up to that. And so as you do this, you want to take the time to really just tune in and pay attention to yourself, your sensations, what you're feeling. And you can do this, again, as often as you want during the day. You want to check in with your body, and you want to really become present in the moment as you do it. So what is helpful is you can associate it with something that you do. So maybe every time you're going to go breastfeed, you're going to go ahead and hold baby and have them, latch on and do the exercise as you're breastfeeding. Or maybe if you are formula feeding, every time you're going to go do a bottle, make a bottle, you can go ahead and do that. Or if you, I don't know, maybe you wash your hands, right, a lot. Every time you go to wash your hands, you take a couple seconds to do that breath for yourself. So I encourage you to try this, incorporate it into your daily routine. And so what I'll do now is I will open up the floor for questions. For those of you watching on YouTube, I do not publish the questions just for ethical purposes, for privacy, for the moms that are asking the questions. So if you would like to join the live Q&A, again, the link is down in the description. So you can go ahead and join us on the next live Q&A so you can get your questions answered. If you have any questions, go ahead and join our free supportive community linked below and feel free to post in there any questions. You can also send me a message, and because you did watch this whole training, I'm going to gift you a guidance call for free. What this guidance call is an opportunity for us to connect, identify your challenges, and see how this holistic and integrative approach will be beneficial for you. So I will go ahead and link that below and use the code word guidance in all capitals, and you'll be able to go ahead and get that free get it scheduled, and we'll be able to connect that way. So as always, I wish you guys all the best, and I will see you soon.